last month. The numbers started climbing middle of February. And I think we had actually gone we had actually left that period after the expected surge with now our numbers are actually higher than they were in July or August.
Maybe, and it's just maybe, it's not blaming anybody, but maybe because we had some mixed messages coming from certain sectors in the government that was not really aligned with the current data that we have. There really is no science that tells you, okay, when the numbers are this low, that it's okay to go ahead and open which part of the economy.
I think we have to stick to what works. No, and I've heard the experts all say that regardless of the variant, the most powerful weapon against COVID-19 is still the diligent practice of the minimum health standard. I think the science is clear and the strategies are clear. We just really have to come together, do what we did last year, and make it work.
Alam ko lahat tayo pagod na. We're all just really fed up with not living the way we used to. And I think it's good to acknowledge that kasi hindi talaga normal yung pinagdaanan natin. Pero yung pinagdaanan natin itong nakaraang taon, masasayang ito lahat. Kung itong home stretch na hinahabol natin bago makarating ang bakuna, hindi pa natin pagtsatsagaan yung mga kailangan natin gawin. Malaki ang hinihingi natin sa isa't isa, no? Na magtsaga pa ng konti, magtiis pa ng konti.
The news day continues here on One News Now. I'm Charles Lejano. The DOH says it is still working closely with the World Health Organization to find out whether there's community transmission of the new COVID-19 variants. To give us more updates from the latest Health Department briefing, Greg Gregorio joins us live from Mandaluyong. Greg, good afternoon. Could you tell us more about this P3 variant that originated here in the Philippines?
Yes, Charles, good afternoon. According to the Department of Health, what we know so far about this P.3 variant, which is first detected here in the Philippines, is that it is composed of multiple mutations, including the E484K and the N501Y, or the mutations that are also present in other SARS-CoV-2 variants of concerns that are the B117 and the B1351, or most commonly known as the UK and South African variant. Recall that these variants are more transmissible, and apart from that, the South African variant has this so-called immune escape that could affect the antibody generation of individual having this variant. Thus, according to Dr. Beverly Ho of the Department of Health, there's also this possibility that the P.3 variant here in the Philippines is also more transmissible and has this immune escape. But this is still not confirmed yet, so they are waiting for the ongoing coordination and investigation with international community about this matter. Charles?
That is some concerning news, Greg, but could you tell us about the latest in our hospital care utilization? Are hospitals getting overwhelmed by the surge in COVID-19 cases?
Charles, this past 2 days, the Department of Health has recorded close to 10,000 additional COVID-19 cases in the country, making the total tally of COVID-19 cases in the Philippines to more than 620,000. But according to the Department of Health, the hospital care utilization rate in the National Capital Region is still at 49%, while its ICU is quite a little higher at 65% or moderate risk. While in Region 7, the hospital care utilization rate is at 47%, while the ICU is quite higher at 49%. NCR in Region 7 and other regions like Region 11 and CAR are the regions that, according to the Department of Health, is showing an increase in cases. But if we are going to look at the statistics of the hospital care utilization rate for the whole country, it remains to be at low risk, which is at 35%. But since some ICU hospital occupancy rate is slowly being filled up, the Department of Health said that they are closely monitoring this matter, and they have already utilized the One Hospital Command System, which will provide the efficient referral network between hospitals where patients could be transferred and be admitted. Charles?
Greg, do we have any updates on the government's vaccination rollout? How many people have been inoculated, and how many more vaccines are we expecting soon?
Charles, according to the Department of Health, more than 193,000 doses of vaccines have been administered since the government started rolling out COVID-19 vaccines. And of the 1.125 million doses that we have received, 90% of which have been distributed to vaccination sites across the country. Now, for the numbers of additional COVID-19 vaccine supply that we are expecting, as of now, what we know is there is 1 million doses of Sinovac coming to the Philippines, which is part of the government's procurement. Then the 117,000 Pfizer vaccines and the 4.5 million doses of AstraZeneca shots that are coming from the COVAX facility of the World Health Organization. Charles?
Right, Greg, have we heard from the Department of Health regarding this alleged violation by PNP Chief Sinas when he supposedly skipped protocol during his visit to Oriental Mindoro?
Charles, according to Dr. Beverly Ho of the DOH, they are not aware of this alleged violation of Chief PNP Sinas. But Dr. Beverly Ho highlighted that those individuals who are waiting for pending PCR results must avoid coming into contact with any other individual, because one may say that he or she has no symptoms, so waiting for the RT-PCR results, it could be a possibility that that individual is incubating the virus inside his or her body. So we cannot be certain if he or she be infectious, even though he or she is not experiencing any symptoms. This reminder from the Department of Health is part of our measures in order to prevent the further spread of the SARS-CoV-2 in the Philippines. Charles?
Right, Greg, any other salient points mentioned by the Health Department during today's forum?
Charles, with regards to the detection of more than 300 cases of different variants of the SARS-CoV-2 in the Philippines, the DOH is highlighting that even as these variants are found to be more transmissible, the transmission still happens because of the breach of the compliance to minimum public health standards. Thus, the Department of Health is highlighting that everyone must still follow the minimum public health standards, even inside their houses, and most especially outdoors, so that we could prevent the further spread of the SARS-CoV-2 in the country. Charles?
Thank you, Greg Gregorio, reporting live from Mandaluyong. We have some breaking news. Palace spokesperson Harry Roque has tested positive for COVID-19. In today's Palace briefing, Roque says he only received the result at 11:29 a.m. and the secretary says he took a swab test yesterday, March 14, to prepare for an upcoming cabinet meeting with President Duterte. He is asking everyone who had close contact with him to undergo quarantine, as his last public event as Palace spokesperson was an event in Imus City held on Friday, March 12. The OCTA research team reveals that the Philippines' reproduction rate is growing faster than expected. Speaking with Cito Beltran on One News's agenda, OCTA research member Guido David says they initially projected an R0 of 1.6 for the country, but now the country's R0 stands at 1.95. They also estimated that daily cases would reach 5,000 by the end of March, but this has already happened mid-month.
Spreading more quickly, and we believe that the variants are partly responsible for this fast surge, because we haven't seen anything like this, Tito. Not in the entire history of our pandemic in the Philippines.
David added that stricter protocols would help curb the surge of infections. This as some areas in Metro Manila are under granular lockdowns have slowed down their coronavirus transmission. But David admits the actual downtrend may not come immediately.
We know that some of these localized lockdowns are working kasi yung trend right now sa Malabon and sa Navotas are decreasing. The trend is actually slowing down there. Except that sa buong NCR, hindi pa nagsaslow down yung trend. We hope na what's happening in Malabon and Navotas will translate into the bigger picture, into NCR. If we can see that kind of slowdown, we may be able to avoid this MECQ na.
Customers have started flocking to supermarkets to prepare for the implementation of the metro-wide curfew and localized lockdowns. Shaila Francisco reports live from Quezon City to tell us more about this. Shaila, could you tell us the situation in supermarkets today?
Charles, no long lines as of yet, but some customers are already buying more than the usual. They say they are preparing in case their respective local government units implement a granular lockdown in their areas. In a wholesale supermarket in Mandaluyong City, customers are buying alcoholic drinks in bulk. This comes as they are anticipating a liquor ban in their area after Quezon City and Parañaque implemented such order. Others, meanwhile, say they are avoiding the rush in case a lockdown will be announced. Among those stock that are fast running out in the shelves include alcoholic beverages and noodles. In some supermarkets, however, only a few people could afford panic buying. On the other hand, supermarket staff note that they are also better prepared for the situation this time around. Unlike during the first mentioned
We'll try to circle back to Shaila later on as we are experiencing some technical difficulties. Meanwhile, the PNP denies that its chief, the bold Sinas, has violated health protocols during his visit to Oriental Mindoro last week. The provincial government of Oriental Mindoro had earlier said that Sinas skipped health screenings upon his arrival in the regional headquarters in the province on Thursday. That's the same day Sinas confirmed that he tested positive for COVID-19. PNP officer in charge, Guillermo Eleazar, has said Sinas actually submitted his RT-PCR test results to the local government. Eleazar explained that Sinas initially had negative results when he took the RT-PCR test 2 days before arriving in Mindoro. Thus, the PNP says the negative result was still valid upon Sinas's arrival, as it fell within the 48-hour validity period. Eleazar also noted that Sinas did not come in close contact with residents at the Calapan Pier as the PNP chief rode a chopper directly to their headquarters. Sinas only took a second test because he was supposed to head to Palawan after visiting Oriental Mindoro. The PNP chief is currently under quarantine in Camp Crame.
I was with the chief PNP, no? When nung kami ay pumunta sa Mindoro actually, we went there to conduct a command visit. And then supposedly, the following day, pupunta kami sa Palawan to supervise and monitor the visit. No, so yung sinabi ng ating OIC na si Chief PNP had his RT-PCR test last March 9, complied with the requirements of Calapan City, which is to submit yung aming RT-PCR result so that they can issue an acceptance letter from the city government. And we had that, so we did not violate anything.
How would you like to receive your coronavirus vaccine in a drive-thru facility? An LGU in Cavite is aiming to offer this service for its residents once shots become available for the general public. Let's find out more from Laila Pangilinan as she reports live from Cavite. Laila, good afternoon. What's the latest?
Charles, the city of Imus has kicked off with their vaccination rollout, but still they want to be a step ahead. That's why the LGU is seeking approval for a drive-thru vaccination as part of their Bida ang May Bakuna campaign. 285 doses of Sinovac and 80 doses of AstraZeneca were initially given to the LGU by the Health Department last week. Imus City Mayor Manny Maliksi, Vice Mayor Oni Cantimbuhan, and the city's health officials led the ceremonial vaccinations at the Hospital ng Imus. But city's vaccine efforts do not stop there. They are seeking the approval of the IATF for drive-thru vaccinations. Yes, you heard it right. Imus is eyeing to conduct drive-thru vaccination for residents if approved by the IATF and other concerned agencies. This initiative will be the first in the country. The dry run for the drive-thru simulation started last week in a mall parking lot in the city. Today, the LGU demonstrated its drive-thru vaccination plan to concerned agencies. The LGU said residents with vehicles can be vaccinated as a family. They said the method will be more convenient, faster, and safer for residents instead of requiring them to be physically lined up for inoculation. Monitoring for immediate adverse reactions will also happen inside a vehicle instead of having people wait in a room for 15 to 30 minutes after vaccination. In the event of an extreme adverse reaction, patients can be taken to a hospital just across the street from the drive-thru vaccination site. Ambulances are also on standby in the drive-thru. Residents will be vaccinated are also not allowed to drive. To register for drive-thru vaccinations, residents will have to undergo number 1, pre-registration using the UBI app, and number 2, counseling, declaration of consent, and final screening on the day of the registration. They will then proceed with the vaccination and strict monitoring afterwards. The LGU stressed that walk-ins will not be allowed as residents strictly have to pre-register online. If the drive-thru vaccination passes the standards of vaccine SARS, Carlito Galvez and the National Task Force Against COVID-19, drive-thru testing will be an addition to other methods of vaccination for residents in the city. Mayor Maliksi said that this demonstration can also give other LGUs ideas in coming up with other options for vaccination. So far, the city of Imus identified 5 fixed vaccination sites that have all begun simulations. If residents have no vehicles, the city health office will deploy their staff to administer the vaccine at home or in a bus as their remote vaccination site. Charles, vaccines for Imus City's private hospitals are set to arrive tomorrow, and Mayor Manny Maliksi said that they will also be polishing this drive-thru vaccinations with the help of these hospitals. Medical frontliners with vehicles will be vaccinated via the drive-thru vaccination dry run. That's the latest here, Charles. Back to you.
Thanks for that. That was Laila Pangilinan reporting live from Cavite. And those are the top stories of the hour. Join Sean Yao later at 2 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.